Well, hello, hello, hello. Good evening, everyone. Happy Monday. Welcome back to the show tonight. Hopefully you had a great weekend and are having a great Monday, had a great Monday as we get into Monday evening. I am so excited tonight. We are going to be talking about the kidney, one of those very important organs in the body. And we've got a special guest tonight that's going to be talking with us, helping us have that discussion. If you are new to the channel, I'm Dr. Dwayne Wood. That's Wood with an E, and the E stands for endocrinology. I help you here on the channel. We help to educate you, empower you, and encourage you to take charge of your health, avoid complications, and live a healthy, fulfilling life. If you're new to the channel, we would love to welcome you. So go ahead and put new in the comments as we get into the evening so that we can give you a hand clap and maybe some music to welcome you to the channel. Also, if you have questions as we get into the discussion tonight, go ahead and put those in the comments and make sure you put a Q in front of the question so that I know that that's one that we need to get to. There are comments that sometimes we're having in the chat, and I want to make sure that I can identify those questions for you and answer those. So great day for me. I had a wonderful weekend, got a chance to hang out with the family, and today got through the day pretty good. We saw a bunch of patients today, but you know, it was so good to be out there, be in clinic, helping to educate our patients and begin to treat them. Well, let's see who is here with us. We've got, I see some people commenting already. So Maria is saying good evening to everyone. Hey Maria, how are you doing? Woohoo! Comes from Maria. Thank you. Monica, what's up, girl? How you doing? Good to see you. How's my little man? Is he doing okay? Glad that you are with us tonight. And two of my favorite ladies are here. Hey Ashley, how you doing? Glad that you are here. And of course, Maria saying hi to Monica and Ashley McHenry. Woo. What's up? She says, love the shirt. That's right, guys. We're going to talk about the shirt here in a minute. Once again, so if you guys have been on the show before, you know that our music is powered by Epidemic Sound. Epidemic Sound, there's a link in the description. If you'd like to try them out, go ahead and do that. They provide some great music for our show, and we love to have them with us. Tonight, like I said, we're going to be talking about the kidneys. So when people hear about kidney disease, when people hear about the kidneys, it's one of those organs and one of those disease processes that sometimes causes some angst. And tonight we're going to have a conversation about the kidneys, what the kidneys do, where they are, how they work, and particularly we're going to talk about the kidneys as it relates to diabetes, endocrinology, right? Diabetes. And to have that conversation with us tonight, we're going to have Dr. Larry Walker, who is a native of here, right? So he grew up in Madison. He did his undergrad in chemical engineering. I think he's a pretty smart fella, and at UAB went away for school, came back to UAB, did his residency, and then his fellowship in nephrology, or the study of kidneys, how to take care of kidneys. And so he's going to help us have that conversation tonight. So why don't we go ahead and just bring Dr. Walker up on the stage. Hey, Larry, welcome, man.
Thanks, Dwayne. Thanks for having me tonight. It's good to be here.
Glad that you are with us, and glad that you are willing to have this conversation and help us understand really the kidneys. Let me go back. Let's go back to the comments for a minute. So Monica is saying, hey, Lauren. Hey, Lauren, how are you doing? Good to see you tonight. Lauren, hi, Lauren. Monica, she said he's doing good. Enjoyed his cake this weekend and now ready for his actual birthday. That's right. So I got to make sure that we get down there so we can see him smash up all the cake. I love the picture that you sent to me. Really cool. So guys, let's go ahead and in the chat, just put some claps. Let's put some thumbs up for Dr. Walker as he's here. if you are on right now, go ahead and send this link, send the message to your Facebook folks, send it to those people that may be doing other things right now. Let them know that they should come on and be with us. Before we get into the discussion, I do want to do a quick shout out, right? You see, I have a very special shirt on tonight, right? This is the Trash Pandas, right? So I'm in Huntsville, Alabama, and this is our team. This is our baseball team. And I went to the store tonight, and I met Amy and Brandon and Landan, right? Not Landon, but Landan. And they helped me at the store today. So guys, thank you if you're on there, if you're watching. And I've got a shout out from Amy, who was at the store. I think she was the manager. I was telling her that I came into the store because of a special person named Ashley, who is on right now, who is the one that directed me to the store. And so Ashley, they wanted me to tell you thank you for being a fan and thank you for directing me to the store. So Amy, Brandon, and Landan, thank you so much. Shout out to you guys. Shout out to the Trash Pandas, and Ashley, a shout out particularly for you. For getting me over there. So I'm excited that I've got this. And I even went so far to buy, right? So I wasn't happy with just one. So I've got my t-shirt. I didn't buy a ball cap, but I'm going to get one here soon. So we'll see. And then, yay. So hello, Dr. Walker from Maria. Hello. Welcome, Dr. Walker from Monica. All right. Very good. Very good. So let's get into it, Larry. Let's go ahead and talk about the kidneys. And so why are the kidneys so important? That I guess let's start there. Why are the kidneys so important? And by the way, guys, so March is National Kidney Awareness Month. And so one of the reasons we have Dr. Walker is we want to highlight the kidneys, and particularly as it relates to diabetes. So Larry, why are the kidneys so important?
Well, the kidneys are important primarily because you can really think of them as a filter for your whole body. So they really filter your blood multiple times a day. As blood is processed through your kidneys, constantly your kidneys make changes to the blood. They help adjust the electrolytes in our blood. They help adjust the acid and base status of our blood. They help get rid of excess waste and toxins in our body that we don't need. And so they do a lot of important functions, mainly around filtration, kind of is the way you can think about it in terms of why our kidneys are so important.
Wow. So it sounds like that's a lot. I remember going through medical school, right? And whenever we got to nephrology, right, there was this acid base thing that everybody talked about and these electrolytes. And when I was in medical school, I kind of almost shied away from that. But you can't really get away from the kidneys, right? Because they affect so many things in the body.
That's right. That's right. They really do. I mean, they affect you in many different ways. And when the kidneys don't work correctly, then we see manifestations all throughout the body, and they can affect different organ systems in different ways that you wouldn't think necessarily that they would. But you're right. It really is a far-reaching kind of effect throughout our whole system.
Right. Now, where are the kidneys located on the body? Sometimes I'll see people that they have like lower back pain. They say, "Oh, my kidneys are hurting." Tell us where they are and so forth.
So that's a good question because you're right. Most people think our kidneys are kind of right around our waistline, our belt line there in the back, but really our kidneys are higher up. So they're up kind of almost just below your rib cage in the back. So they're a little bit higher. So wherever your belt is, your waistline of your pants, it's not down that low. They're going to be higher up in that region. And so a lot of people ask if they're having pain, is that coming from their kidneys? And really there's only two ways that you have pain from your kidneys. And one is if you have a kidney stone that's causing a blockage and your urine backs up into your kidney and causes it to swell, then the capsule, the outside part of the kidney, as that stretches, that causes pain. The other way is if you had an infection, a serious infection that spread from your bladder up to the kidney, and again, that causes the kidney to swell from the infection, then that would cause the outside capsule of the kidney to stretch, and that would cause pain. So it's interesting. So there's no pain fibers inside the kidney, and so if you had surgery and they were cutting inside of your kidney, you would never feel it. And so, but it's always confusing because in that same area where your kidneys are, then you have a lot of large muscles from our back, and also nerves that come off of our spine that go across the area of our kidney down into our legs. And so when you have pain in that area, it could be back pain, it could be nerve pain from our spine, or it could be represent a kidney stone or a serious infection that way.
Wow. Okay. Okay. Well, so you mentioned several things, right? Acid base, fluids, and so forth. How do the kidneys really work? Can you give us a quick thumbnail on what that is like?
Sure. So in the kidneys themselves, there's little filtering units, many in each kidney called nephrons. And so as the blood goes through that part of the kidney, they're very tiny, microscopic little organisms inside that only filter. Basically, they're so small that only one red blood cell can pass through at a time. And as that happens, it goes through many different changes as it courses through the kidney in this little nephron. And so as that happens, then water is coming in and out of the kidney, electrolytes are coming in and out of the kidney. And so as that happens, this filtration process takes place. And at the end, as it gets to the very end of this, I guess you can think of a pathway through the kidney, what is left over becomes what our urine is, and it drips down then into our bladder, and then we expel it from there. And so there's a kind of a constant barrage of things that happen through little channels and many different things which are really kind of remarkable that we've only really been able to understand more fully in the last 30 years.
Wow. What really kind of surprised me when I first started learning about the kidneys is the amount of work that these little organs do, because they're processing all of the blood that's in our body and filtering out, so many varied things that are coming through the system. That's
right. And you're right. The kidneys are not that big. The real size of our kidneys are really about the size of your fist. So that's about normal size. Our kidneys are usually somewhere between 9 and 12 centimeters in length. So it's not very big. And you do have two of them. But you're right. Constantly blood gets passed through the kidneys multiple times each day. And that filtration process is ongoing on a constant basis, every minute, every second of the day.
Wow. Can you tell us a little bit, how does kidney disease I shouldn't say kidney disease. How do the kidneys regulate blood pressure? How do they help with that process?
So part of the little glomeruli, the little smallest filtering parts of this whole nephron process, have different little cells or receptors that detect blood pressure and detect how much fluid is passing through them at a certain period of time. And as that happens, there's signaling back and forth to different parts of the nephron that will adjust how much the little blood vessels either expand or contract. And as that happens, then that helps to change our blood pressure. Now, our blood pressure is controlled by other things outside of the kidneys, our heart, our brains have an effect on that too. But the kidneys have a direct effect on that as well. And so there's been many medications developed that have a direct effect on the kidneys that actually control our blood pressure. And that's how some blood pressure medicines will work in that standpoint. And that's that kind of direct relationship there. It's kind of what they consider a feedback loop, whereas there's changes in pressures, different chemical signals will signal different changes in the way that the blood vessels are reacting.
Okay. Wow. So we're going to get to talking about diabetes affecting the kidneys here in a little bit, but what are some other disease processes that we see in the kidneys?
Sure, that's a great question. So in the United States, the number one cause of abnormal kidney function or kidney disease is high blood pressure. Diabetes is a close second, as far as that goes. But then there's a whole list of other things that can affect our kidneys. And so other diseases, so things like multiple myeloma, which is a form of blood cancer that you can develop. It can affect the kidneys. Something called lupus. Lupus is connective tissue disease that affects the body throughout. And so in certain situations, it can affect the kidneys, even leading to kidney failure. Then there's much more rare types of kidney disease, which are not really caused by necessarily anything we do, but they happen sporadically. And so there's a whole list of medicines. If you look at Google, you'll see things like membranous nephropathy, focal segmental glomerulosclerosis. And these are names that sound like a bunch of medical mumbo jumbo, but they kind of describe what's seen on the kidney if a biopsy is done and these disease processes there. And so there's a lot of things that can lead to that. Now, the other thing that can lead to that's pretty prevalent is heart disease. If you have significant heart disease and develop congestive heart failure, especially, congestive heart failure then can start to affect kidney function and lead to something called cardiorenal syndrome, meaning that the cardiac dysfunction starts to affect the kidney function, and vice versa.
Wow. So it sounds like there are several disease processes that can affect it. And what sometimes still fascinates me is that disease processes that are so far away, quote unquote, from the kidneys, right? They affect a joint, for instance, some of the rheumatologic diseases, and they actually have an effect on the kidneys.
Absolutely. So, yeah, so it's not just right. You're right. That's not just right in the kidney itself. I mean, some diseases are specifically in the kidney, but a lot of them are not. So high blood pressure, diabetes, heart disease, lupus, all of those kind of things are happening in other parts of our body, but then start to have an effect on the kidneys over time.
Right. Wow. So are there things that people are aware of when they start to develop kidney disease? Is that something that they feel? Can they tell? How do they know that, okay, maybe something's going on in the kidneys?
Well, that's a good question, because really there's no really signs or symptoms to let you know that you have kidney disease. You could live with kidney function from basically 100% normal function all the way down to about 10 or 15% before you start to develop any signs or symptoms that would let you know that you had kidney failure. So a lot of times the way that kidney disease is found is just through routine blood work. So you're going in, you're having your routine physical examination. You usually don't have any symptoms, but your doctor checks your labs and says, hey, there's something wrong with your kidneys. I'm going to send you to see a kidney doctor. And so most people are surprised when they come to see me, because they say, well, there's nothing wrong with my kidneys. I go to the bathroom 5 times a day, just like I did 5 years ago. But it's not that kind of thing. It's more of what we see in the blood work that is telling us that there's been damage to our kidneys or loss of kidney function that way. And unfortunately, there's just no symptoms. If you start to develop symptoms from your kidneys, that means your kidney function is pretty far gone, and that's not a good thing for sure.
Now, one of the things that I guess a lot of specialties will see people for, endocrinology, rheumatology, nephrology, is fatigue, right? So everyone comes in and there's the fatigue. So a lot of times I'll have someone come in and say, hey, my thyroid is off because I'm tired, right? I say, well, it could be that. I'm not saying it's not, but it could be, your lupus, or it could be your rheumatoid arthritis, it could be your kidney disease. How do you, if someone's out there right now listening to us, and we don't want everybody to just run over to their doctor and say, hey, check my kidneys, but how do they go about really finding out about the kidneys?
So the best thing I think with that is just making sure you're getting routine physical examinations, because as part of that examination, you'll get routine blood work, chemistries will be checked, and part of that will check the kidney function. In addition, you'll usually get a urinalysis done at the same time. Urinalysis is another way to pick up on kidney disease. If you get a urinalysis and they find that you have protein in the urine, or they find that there's blood in the urine, and it's not associated with an infection, or it's not associated with kidney stones, then that's a sign, hey, there may be something going on with your kidneys. We need to look at that a little bit further that way. And so since there's not a lot of symptoms of kidney disease, that's the best way, I think, to get a good handle on what might be going on with your kidney function and if your kidneys are healthy. If you get those exams and your electrolytes look normal, your kidney function looks normal in the blood work, your analysis is clear, then I think you can feel usually pretty good that your kidneys are healthy and that you don't have a major issue at that point.
I love that. Love that. So for guys, if you're out there listening right now, if you're listening to the replay, I want you to remember what Dr. Walker said at the beginning of that part of the conversation. Make sure that you are getting regular routine physicals, right? Because one of the things that happens is that if we're able to catch things early, then we can prevent progression or delay progression. But we want to make sure that you're out there, that you're getting those routine physicals. Well, let's pause here for a minute. Let's see who's joined us. And I think I saw Miss Latine. Hey, how are you doing? You said, great subject. So glad you are addressing it. Videos teach us so much. So glad that you're here. Latine, she is one of our faithful watchers. And then, of course, Maria is saying hello to her as we get into welcoming everyone. And then I see Jennifer's here. And Jennifer, you always ask some good questions, so I'm going to flag that to come back to. Monica's asking some questions there. I do see you there, Jennifer. I'm not going to put your question up yet, but hi to you. Good place also for us to do a quick station identification. So if you have not already done so, please go ahead and check us out on all of our social media platforms. We've got LinkedIn, TikTok, of course, here on our live at 7 on Mondays. We've got Twitter, and then Buy Me a Coffee. If you have something that you want to comment on or say to us that you don't want to put in the chat or in the video comments, go ahead and send us a message, dwainwoodemd @gmail.com. And if you want to get more exciting content from us, then watch us live next week, 7 p.m. right here. We've got our TikTok that comes out Friday morning at 10 a.m. And then every day we have got our Twitter. And so on Twitter, and we've started putting those on some of the other platforms as well. But on Twitter, we have our recipes. We have our information on exercising and sleeping and motivation and all of those. So please make sure that you are taking a look and getting to those. Okay. So thank you guys for always. Thank you for being here and for supporting our channel. So now we are continuing to have our conversation with Dr. Larry Walker as we talk about the kidneys, and we're going to get into a big topic here right now, talking about how diabetes affects the kidneys, what is going on there, and so forth. So Larry, I think I read something. I think 37 million people with kidney disease, 34.2 million people with diabetes, and a third of type 1 diabetics, and a half of patients who have type 2 diabetes suffer with kidney disease. That's a huge number.
Sure. You're right. It is. And it's interesting because overall, I think, 40% of people with diabetes, only 40% will ever develop any kidney problem. So the question becomes, well, what's different about the other 60%? Why do the 60% of people with diabetes not ever develop any kidney issues? And so that's been a question for many years, and a lot of researchers have studied that, hoping that if they could find what's different about the person that's in the 40% group versus the 60% group, that could lead to more targeted therapies. Hopefully that would lead to a lot more knowledge. But so far, through many studies and lots of researchers at many universities throughout this country, they've not been able to identify what is different about the people that develop kidney disease with diabetes and the people that don't. And so that's an interesting question that a lot of nephrologists are interested in, and for all those reasons. And I know that we'll find it one day. It's just a matter of time. But I'm hoping then that's going to lead to much more creative and new and innovative therapies down the road.
Right. Well, so describe to us a little bit how does diabetes cause damage to the kidneys?
Yeah, so that's the interesting thing. So in the little filtering parts of the kidneys, in the little glomeruli, uh, the um, the walls of the glomeruli have tiny little slits in them, and so they're tiny, and so usually only water and electrolytes can pass through those slits. But what happens is that if diabetes starts to affect the kidney, those slits start to become enlarged and open up. And then proteins, which are very much larger than water and electrolytes, can start to pass through those holes. And then as a result, when we test one's urine, then we see protein in the urine. And so that's one of the first signs that diabetes has affected somebody's kidney. And so that's why it's important when you're seeing your endocrinologist, you're always going to be getting the urine checked, because if you have diabetes, Dr. Wood wants to know, if there's protein there or not, because it makes a big difference to the way he looks at things and how he's going to treat you, as far as that goes. And so that's one of the first things that we see. And so that diabetes effect over time, then causing those slits to enlarge, then lets us see that there's protein coming out in the urine, and we know then, hey, there's something going on in the kidney, and we've got to look at that a little bit further.
Right, right. Yeah. Yeah. I sometimes will describe, the kidney as a sieve, a strainer. And I will tell people, like you said, that the diabetes makes those holes bigger, and things that shouldn't pass through will pass through. And that's what we're seeing in the urine. What are some, as people are listening, diabetes affecting the kidney, what are some names that they may hear or see when we talk about diabetic kidney disease? What are some other names that might be called?
Sure. So, and you may see some of this on some people get, your printout that has all your diagnoses on there and these diagnosis codes, and you'll see things like maybe diabetic nephropathy. And again, that just means diabetes that's caused a disease in the kidney. Diabetic kidney disease is kind of the maybe the latest and the newest kind of terminology that we use to talk about that. Some people will see things, diabetes with proteinuria. That may be another thing. And then proteinuria just meaning protein in the urine is all that medical term means. And so you'll see some of those, or some combination of those, a lot of times will be what we'll see, and what this is called when you have diabetes effects on the kidneys.
Right, right. Wow. Okay. And so now we've got diabetes affecting the kidney. Or I guess let's walk through it. Someone has diabetes, they're being checked. They don't have any symptoms because, they may not have any. They now have some protein in the urine. When someone comes into your office, right, with that, they're afraid because, first of all, they're going to see the kidney doctor, right? Once again, that idea of kidney problem. Walk us through what goes on as you see a patient initially.
Sure. Well, when you first see the patient, then again, it's going to be, looking over their records, finding out about their medical history. What other medical problems do they have? Do they have other problems, besides diabetes? Is there high blood pressure there? Is there heart disease there? Is there problems with vascular disease? Do you have poor circulation? Are there other diseases that you might have? Do you have lupus? Do you have any blood diseases, anemia? Because while diabetes affects in the kidneys is a very common cause of diabetic kidney disease, we don't want to miss another kind of problem that's going on, because even people with diabetes can have lupus that's affect their kidneys, could have multiple myeloma that's affecting their kidneys, could primarily have high blood pressure or heart disease that's affecting their kidneys. And so before I blame their findings on diabetic kidney disease, we need to take a look and make sure that there's nothing else going on that could be affecting the kidneys as well that way. And so getting a good history, finding out, what medications they're on, what other specialists they're seeing, can be clues to what's going on. And then looking from there, then it's a matter of checking out their lab work. You're probably going to get an ultrasound of your kidneys to look at your size and shape, make sure that we're not missing other problems there in terms of kidney stones or something that's causing blockage in the urine flow. We're looking to see, do you have protein in the urine? Do you have blood in the urine, and things like that? Because if there's questions about whether it may or may not be diabetic kidney disease, then we may have to look at doing a kidney biopsy to know for sure, because that's the gold standard, because that will tell us for sure, is this all diabetic kidney disease? Is it all high blood pressure kidney disease? Or is it all lupus kidney disease or some other form that we may not expect to find?
Oh, okay. So it's evaluation to verify that this really is diabetic related. Okay. Um, and so this patient comes in, and let's take it further down the road, right? Hopefully we catch it early. We do some things that prevent progression to this patient. But let's assume that this is progressive, right? So that we didn't catch it early. We haven't been doing anything to kind of temporize what's going on. So now we're go through for us the stages in the progression of kidney disease, and what do we do as we get further into those stages?
Sure, sure. So I guess one thing in terms of the terminology is about 12 years ago or so, Medicare kind of made us kind of conform to one kind of terminology for what we call chronic kidney disease. And that became the term for all forms of kidney disease. And so they wanted to make it standard because before that, there were about 5 different names. People called it chronic kidney disease or chronic renal failure or other things. And so at that time, we kind of made all kidney disease in general called chronic kidney disease. And they decided that they would break this down into 5 stages. So depending on what your level of kidney function is, would depend on what stage you were. So if you were stage 1, you're pretty close to normal. Your kidney function was about 90 to 100% of normal. Then they divided it in stage 2, 3, 4, and 5. So if you're stage 5, your kidney function is less than 15%, then basically that's, pretty much you're at kidney failure or very close to it. And then you're needing a kidney transplant or kidney dialysis at that point. And then you have stage 4, which is severe disease, but not quite that bad. Stage 3 is the kind of the middle, and it's the biggest group, and that's kind of where most people fall. If you look at studies of people with chronic kidney disease, most people are going to be in that stage 3. And then 2 is kind of mild kidney disease. Your kidney function somewhere between 60 and 80% or 85% at that range.
Wow. So you mentioned that big D word, right? So we've progressed. The disease has taken its course, and we're to the point now where we are stage 4, and so we're starting to have the conversation. Talk us through a little bit of the conversation about progression from stage 4 into later stages, talking about renal failure, end stage renal disease, as we we learned it, and then dialysis.
Sure. So you're right. So when you get to that kind of stage, where you progress, if your kidney function has slowly decreased and you're into stage 4, then that's the point where we really have to talk about, okay, what's the plan going to be? It looks like your kidney function has progressed over some period of time. We think you're probably going to end up getting to the point of having end-stage kidney disease, and we have to make a plan on what we're going to do. And so that's when there's a lot of education about dialysis that comes into play, because most people don't know anybody that's been on dialysis. I mean, dialysis is still relatively rare in the general population. Sometimes you may have had a distant relative that's been on dialysis. Sometimes it may have been someone who's been on dialysis in the distant past. And I can tell you that dialysis today is very much different than it was 30 years ago in terms of patients' ability to tolerate dialysis and in terms of the different kinds of dialysis. So it becomes an education about what is dialysis, what are the different kinds of dialysis. You can do dialysis at home, you can do dialysis in a clinic, you can do dialysis in a clinic while you sleep, you can do a form of dialysis while you sleep at home. And so it becomes an educational kind of process about that. And then on top of that, then talking about the possibility of kidney transplant. Are you healthy enough to undergo a kidney transplant? What other medical problems do you have? Is this going to be a possibility too? Because again, when you get to stage 4, that's the time when you have to start looking at things and talking about what are the options going forward in terms of how we're going to deal with that. And so once you make those kind of decisions, then it becomes, okay, if we're going to do dialysis, we have to look at seeing a vascular surgeon, because we're going to talk about having a fistula or a graft placed, which is a form of what we call access, a way to do the dialysis treatments. It's something that has to be created by a surgeon for this to happen that way. And so there's a whole lot of that. And then when you get to that point too, there's a lot more restrictions that have to be put in place from a dietary standpoint, because as the kidney function declines, there's going to be more problems with managing your electrolytes. They're going to be much more abnormal than if you're at stage 3 or stage 2 kidney failure.
Okay. All right. So that's not where we want to go, right? So we say, hey, let's catch this early. Are there ways to protect the kidney? First, let's start as we are treating diabetes, right? Because we're talking about diabetes in this section. Are there ways to protect the kidney as we get into our diabetes? And then secondly, if we already have some kidney disease, some chronic kidney disease, are there things we can do? So let's deal with the first one. Are there ways to protect the kidney from developing kidney disease?
Absolutely. One of the most important things is making sure that the blood pressure is under control. Many people with diabetes also have high blood pressure. And if you do have high blood pressure, we know that's one of the number one causes of abnormal kidney function. And so we know that treating your blood pressure and keeping it under control makes a huge difference. If your blood pressure is always typically 150, 160, 170, that's not good. We know that there's a much higher chance that you're going to develop kidney failure and end up needing dialysis or a kidney transplant. If your blood pressure is under control, if you're keeping it in the 120s, the 130s kind of range, that we know that your kidney function is going to last a much longer period of time. And the same goes for diabetes. If you have diabetes, we know from a lot of studies that were done several years ago that we used to say, well, if the blood sugar is around 200 or less, we're probably doing good. So that's good enough. But that's not good enough, because people in that group who had blood sugars that averaged around 200 had a much higher chance of developing kidney failure and needing dialysis. People whose blood sugars were much lower, in the 120, 140 range, their kidney function lasted a much longer period of time. And so when you're seeing Dr. Wood and he's talking about that hemoglobin A1C and trying to get to goal, that's why it's so important to get to goal, because if you get to goal, again, it's going to protect your kidneys. There's going to be less chance that you're coming to see me. There's going to be a lot less chance that you're going to need dialysis. And so that's very important.
Awesome. All right. So I love that. So here's a good place. So we've kind of talked through the process, talked through the effect of diabetes. So two points that I got from what you've been saying. So one, make sure that we are connected to our healthcare system so that we're getting regular, routine evaluations, which include evaluations for the kidneys, because we're getting CMPs, BMPs, we're getting urines. And so a lot of things will show up in those places. One, because sometimes kidney disease, unless it's far along, doesn't show up as symptoms.
Exactly.
And then number two, we can protect our kidneys by controlling some of the disease processes that we do have. Now, are there things that are risk factors for, if I have diabetes or I have hypertension, are there things that are risk factors for helping me or making me progress faster?
There are. So especially with diabetes, we know that people with diabetes that have diabetic neuropathy, who have the numbness and tingling in the feet and toes related to the diabetes, or also have diabetic retinopathy, meaning that there's been diabetes effects on the retinas, the backs of our eyes. When you go to the eye doctor, they can see those changes when they dilate your eyes and look in the backs, because the blood vessels in the retina, the blood vessels that feed the nerves in our feet, are the same size blood vessels as in the glomeruli in the kidney. And so once one of those areas is affected, usually all of those are affected. And so we know that if you have those things, there's a much higher chance that you're going to also have kidney disease related to diabetes as well. Not always, but a lot of times they do seem to go hand in hand. And so that's one of the risk factors that we always kind of look for.
Right. Wow. Okay. Well, let's see. We saw some questions that are out there. So let's see if we can grab some of those. And once again, guys, if you do have questions, go ahead and put a Q in front of them. So let's start. Let's see. I saw Monica. So Monica had a question here. Let's change our screen a little bit so we can grab it at the bottom. She says, why can the first morning urine have falsely elevated creatinine? And I'm assuming she's meaning protein. So what's the answer to that question, Dr. Walker?
So there can be some extra protein the first morning, time that you go to the bathroom. that urine has stayed there and it's been in your bladder all night. So it's been there for a longer period of time. And so as a result, there can be some changes in the urine that develop at that period of time. It's become more concentrated. And so when we check it with a dipstick, you'll see a little bit more protein there as far as that goes. Some of that has to do with just the concentration and length of time it's in our bladder. And some of that has to do with the fact that you're lying recumbent, you're lying in bed all night during that period of time will have some effects on that as well. So you can actually, part of the kidney can actually what they call secrete extra protein during that period of time. And then that kind of shows up with that. And so that's why it's always good to, get, if we're looking at somebody who has protein in the urine, we always want to get a second look at it to make sure that, hey, well, this is not just one of those first morning, kind of checks that we've had. We want to get something later in the day, which is going to give us a little bit more accurate, and just to make sure that the first one is confirmed.
Right. Okay. Good. And then here's another one from Monica. She says, if you've had a kidney removed, what kind of issues can that cause?
So that's a great question. I get that a lot. I get patients asking me about that because they may want to consider donating a kidney to a friend or a relative who needs a kidney transplant. And so they're like, okay, well, what's going to happen to me? What am I looking at if I give my kidney away to somebody? And the answer to that depends. So if you're healthy, if you don't have high blood pressure, if you don't have high diabetes, if you don't have heart disease, and you have normal kidney function, then you should be able to donate a kidney and you should be able to live a completely normal life. The only real issue that develops is that later in life, if you then go on to develop high blood pressure, if you go on to develop kidney disease, these processes start to affect your kidney. Since you only have one kidney, then you may not have as long a period of time to live with chronic kidney disease before you develop kidney failure. The other issue can be if you have a kidney stone and it causes a blockage and you only have one kidney, then that can cause kidney failure. If you have two kidneys and a kidney stone develops and you cause a blockage, well, you got the other kidney working, and so it's really doing all the work of the other one. There's going to be no change in your kidney function. So those are the issues that really develop. But in most of the studies where the transplant centers have looked at people that have donated kidneys, there's really essentially no change in their lifespan and really no change in their kidney function over time. They really have very little increased risk of developing kidney failure that way.
Right. Okay. Good question, guys. Let's see. Here's one from Jennifer. She says, how come, I think she's saying, how come taking ibuprofen can cause abnormal creatinine and GFR on your labs?
Sure. And that's a great question. And so ibuprofen, Advil, Aleve, Motrin, all these medicines, they're over-the-counter medicines that people take all the time for headache or for fever or for muscle aches, for pain and things like that. Because of the way that they work, they have a direct effect on the kidney. They produce some little molecules called prostaglandins that can affect the blood vessels, the way they constrict or dilate in the kidney. And as a result, then that changes the kidney function or filtration. Now, if that's something that is happening, kind of on a short-term basis, usually that's reversible. But that's one of the things that I see a lot, and especially in older folks, people who have been on these kind of medicines for a longer period of time. I'm talking about years, that can lead to irreversible kidney damage. Now, that's not always leading to kidney failure, but it may be that you're left with abnormal kidney function and you've got chronic kidney disease. Maybe you're in stage 3 now that way. And so that's why I always try to encourage people that if you're taking those kind of medicines, if your kidney function is normal and you're healthy, there should not be a problem with you taking those medicines. But if you get to the point where, well, you feel good taking them and you're starting to take 3 or 4 ibuprofen every day and a year or two goes by, then that's when you may start to say, okay, something bad is going on here. We've got some loss of kidney function that we've got to look at that way.
Wow. Okay. All right. And then I think this is a follow-up for what we've been discussing. What is the best way to keep your kidneys healthy? What's the best way to keep your kidneys healthy?
Sure. And so I get a lot of questions about that. A lot of people ask me, well, how much fluid should I drink? And so there seems to be this idea out in the world that you need to drink 8-ounce glasses of water a day and that's healthy for your kidneys. But there's no real scientific evidence that you need that much water every day. and you probably need to have 4 or 5 glasses of water, juice, milk, liquids every day. But you don't really have to buy great big bottles of water and try to drink those huge bottles every day, and in terms of improving your kidney health. And then some people ask me, well, what should I drink? Well, water. I mean, water is great. I mean, I think it's natural. That's what our body is made up of. 60 to 70% of our body's water anyway. So I think water is the healthiest. But if you don't like water, I mean, certainly there's other things that are good to drink too. Most everything we drink is mostly water. It's probably 90% water. It may have other things in it. Milk has protein in it. Soft drinks have some sugar and color in it, and those kind of things. Generally, from a kidney standpoint, though, we think about soft drinks. The clear colored ones are probably the best. They have citric acid in them. They have some beneficial effects at preventing kidney stones. Whereas the dark colored colas, RC, Pepsi, Dr. Pepper, Coca-Cola, have phosphoric acid in them. And so that actually tends to promote kidney stone formation. And if you have kidney disease, it can raise your phosphorus level, which your body has trouble managing if your kidneys are not functioning properly. And so those are the ones that I would say to try to avoid as far as that goes.
Okay. All right. Here's one from Hazel. Hey, Hazel, welcome. And here's a question. Is it true that metformin is bad for our kidneys? Is it true metformin is bad for our kidneys?
So that's a great question. So no, metformin is not bad for our kidneys. I mean, metformin does not have the same effect on our kidneys like ibuprofen does. The problem with metformin in the kidneys is if you develop abnormal kidney function, then some of the metabolites of metformin can start to collect in our body and increase. And if that happens, then there's a chance that it could cause a buildup of lactic acid in the blood that could make you very sick, and you would end up in the hospital. So it's not causing a direct damaging effect to the kidneys. It's more the other way around. But because your kidneys are not normal, then metformin metabolites start to build up and can lead to other problems. And so I get that question a lot. But it's an important question. That's a great question.
Yeah. I'm so glad that Dr. Walker said that, because we get that question all the time. Why did metformin damage my kidneys? And I tell people, well, and let me change that. It's not that metformin damaged the kidneys. It's that if you have kidney disease to a certain extent, to a certain degree, then you shouldn't be on metformin. And so a lot of times we will see people who will talk about the damage that metformin causes. So glad that you said that, Dr. Walker. All right. And then here's one from Monica again. She says, what causes a kidney stone and a kidney infection? What causes a stone and an infection? Sorry, this is from Ashley. Sorry, Monica.
Yeah. That's a great question. So the bladder infection issue is just that normally our body kind of defends against bacteria that live on our skin because every time that we urinate, that helps to flush out bacteria from our system. And so some things that lead to a higher chance of that are, one, if you get dehydrated, so you're not going to the bathroom very much, you're not urinating as much as possible or as normal, then you'll see a higher chance that those bacteria can kind of climb inside and set up an infection there. If you have other problems where, for older men especially, prostate problems where you don't empty your bladder as well, then you're retaining a lot of urine. Urine that sits in our bladder for a long period of time is kind of a great place for bacteria to start to develop and grow, and then that can lead to infection there. And so those are some of the issues that we get into with bladder infections. Now, in terms of the kidney stones form when little substances that are in our urine normally, like oxalate, like phosphorus, like uric acid, start to come together, and they form what is called a nidus. And that just means that clumps of these little electrolytes of these little substances get together, and then as a result, they can start to grow, and then a stone will start to develop as a result of that. We know that stones are oftentimes not genetically inherited, but they do run in families. So oftentimes people have kidney stones, know that their mom, their dad, their aunt, their uncle, or their sisters or brothers have kidney stones. And also, if you look at a map, we live in the stone belt. If you draw a line you can look at from kind of Arkansas through northern Mississippi, Tennessee, Alabama, South Carolina, Georgia, all the way through there, there's a higher incidence of stones in this part of the country than other parts of the country. And so Why that is, a lot of people say, well, it's the limestone in the water. There's a lot of debate about that, but clearly there's more stones in this part of the country than other parts.
Awesome. Awesome. Love that. Thank you. Thank you. Well, guys, let's do our thought for today. All right. Yeah, I was dancing back there with the music. You guys caught me. So John Wooten said that we should make each day our masterpiece. Make each day our masterpiece. An interesting thing happened when I was going through medical school. So I had actually graduated from college. I went to graduate school. I got married when I was in graduate school, and then went to medical school, and then did residency and fellowship. And as I was going through each of those phases, there were a lot of times when I said to myself, when I blank, so when I graduate from college, I'm going to. When I graduate from medical school, I am going to. When I get married, I'm going to. When I have a child, I'm going to. When I finish residency, I'm going to. And at one point, this particular statement came into my thought process. Make every day a masterpiece, because today is a microcosm of my life. And my life doesn't begin when I achieve a particular thing. It begins like when I wake up that morning, right? But oftentimes we are waiting for some big grand change in our life for us to begin living. And today we can begin. We mentioned last week that start now, right? Don't wait till tomorrow. Start right now. And as you're starting now, how you wake up, how you progress through the morning, how you progress through the day, how you progress through the evening, how you work on this masterpiece determines what the effect is going to be for the rest of your life. We've talked about the process. A circumstance dictates, is affected by your thought process. Your thought process determines your feeling. Your feeling determines how you behave, and your behavior gives you a result. So make today your masterpiece. Not tomorrow, not when you finish that grand thing, not when you get that degree, or you get that new job, or you have that new child, or you get married, but today. If you begin enjoying today, if you begin living today, then ultimately your goals are in reach, and you begin having fun right now. That's our thought for today. Dr. Walker, we are so excited that you have been with us. Thank you for joining us. Why don't you take a moment to tell people how they can reach you? How do they get to be a patient of yours? What's your website, your phone number, that type of information?
Sure. So my office is right here in Huntsville, downtown, near the Heart Center on Franklin Street. And my phone number is 256-533-7676. That's the best way to get in touch with me. We do have a website, Huntsville Renal Clinic PC.com. And again, that has a lot of information about the office and about me and my partners and how to get in touch with us. And most people come to see me, most are referred by their primary care physician or their endocrinologist or their cardiologist. So those are the ways that I get to see most of my patients are through those referrals.
Awesome. Awesome. Thank you once again for being with us. We really appreciate the information that you've given us. Let me move this over here. So guys, thank you for joining us. As always, we appreciate what you do for our channel. If you've not done so yet, go ahead and check us out on all of our social media platforms, LinkedIn, TikTok, here on YouTube, Twitter, and then of course, buy me a coffee. Check out our show every Monday at 7, our TikToks on Fridays, and our Twitter that comes out every day. So thank you. Here on this channel, I help to educate you. I help to empower you. and I help to encourage you to take charge of your health, avoid complications, and live a healthy, fulfilling life. Thank you for being here. Share this video. Give us a thumbs up. Like us. Check out the Trash Pandas, okay? They're starting up, when is it, next week, next month? Go ahead, get to the store, ask for Amy and Brandon and Landon, and go ahead and make sure you get some tickets and get out there and watch the game. COVID has taken so much from us. Let's get back and let's enjoy being in our lives, right? Remember, make today the masterpiece. This is Dr. Dwayne Wood from Diabetes and Endocrine Wellness Center and The Light Away, educating the public for a better you. Let's get some music and let's get on out of here.